Following the US government's freeze on aid, the availability of ARV drugs in Kenya faces an uncertain future. Let's take a look at what the stock levels were at the end of January 2025. Nationally, both at the facility and the central store, there were less than 6 months of stock for various first-line ARV drugs for adults at the hospital levels, except for only 2 drugs which had more than 12 months of stock. Nevirapine, a first-line ARV for children, had less than 1.5 months of stock nationally and nothing was at the central stores. The government was, however, expecting 17 months stock of the drug. According to the medicines dashboard, most of the ARVs for children had less than 6 months of stock at hospitals across the country, save for only one drug, efavirenz. At the central stores, children's ARVs were also running low, with only one drug, DTG, having 12 months of stock. All the rest had less than 10 months of stock. At the central stores, 2 first-line ARVs for adults were neither available nor were they pending arrival. 8 of the drugs that were in stock had less than 10 months of stock, while 3 had more than 10 months of stock. Only 2 ARV drugs were pending arrival. Majority of the ARVs for children were understocked at the central stores, with less than 10 months of stock available. 1 drug wasn't in stock. However, 3 of the 9 ARV drugs for children were pending arrival, whereas for the other 6, there was no indication of any stock being expected in the central stores. Majority of ARV drugs for adults had slightly over 2 months of stock in all facilities across the country. The lowest drug had 2 months of stock, while the drug with the highest months of stock had 280 months of stock. ARVs for children had between 1 and 4 months of stock at the facilities. 5 of the 9 drugs had over 3 months supply at the facility level. As at the end of January 2025, the NASCOP Medicines dashboard indicated that only 6 out of the 47 counties had less than 3 months of stock of ARV drugs. Majority of the counties had more than 5 months of stock of the ARV drugs.